It's the first briefing of the Ministers of Health since the assumption of office. This briefing, which is attended by the Permanent Secretary of the Ministry, Mrs. Kachilum Daju, and directors in the Ministry of Health, is following a 3-day ministerial briefing session with departments and parastatals under the Ministry of Health. The meeting is to provide information on the realities in the health and social welfare sector and to roll out plans on how to reform the sector in line with the renewed hope agenda of the present administration.
So thank you very much for...
The coordinating Minister of Health and Social Welfare, Professor Ali Pate, announces the blueprint, which he believes will review the nation's healthcare system.
Will strengthen the regulatory capacity of our institutions. Institutions like NAFDAC, to regulate better the quality of what gets into Nigerians, their food, their drugs, and other health professional regulatory entities that need to regulate the practice. And that is only on the federal level. We will work with the states to improve the regulatory function at the subnational level. There have been reforms that led to the National Health Act, which have not yet been implemented. So implementing the National Health Act to its fullest would be so key, including the basic healthcare provision that put primary healthcare at the foundation of our healthcare system.
He also touched on the issues of doctors leaving the country and the need for more funding for the health sector.
The human resources is the most important ingredient for producing health. Lifeblood of health system is people, wherever they are. So we have met with stakeholders. We said we'll work as a team. We're all health providers. There are leaders within those health provision practices. But at the end of the day, it's all of us collectively as Nigerians in a unified way that will need to work better. Those talents have to be trained, deployed, retained, and the quality of what they deliver ought to be improved. And hopefully those who have gone away can begin to find their way back home.
Still maintaining the resolve for a renewed health sector, the Minister of State for Health, Dr. Tunji Alausa, wants Nigerians to expect a digitized healthcare system where proper data gathering will be validated and trusted to help deliver proper healthcare to Nigerians.
As part of our digitalization of our healthcare system, we're going to roll out a national electronic medical record, electronic medical record platform, where our primary care centers, all our tertiary hospitals will come on the same platform. Then, as we move into the future, we'll encourage each state government to use the same platform.
The Minister of Health has made a couple of promises to Nigerians as regards his plans to reform the sector, from digitalization of the sector, provision of more funds for research, medical industrialization, amongst others, basically saying it won't be business as usual. But Nigerians will expect that this time, words will be matched with action to ensure implementation of these reforms to indeed improve Nigeria's health sector. From Abuja, Victoria Longchan, Channels Television News.